everybody. I'm Jennifer Valoppi. I'm the founder of the Women of Tomorrow Mentor and Scholarship Program. It's a program that works to uplift the lives of at-risk young women in public high schools by teaching life skills and also pathways out of poverty. I'm also a 30-year veteran almost of television news in New York, Los Angeles, and Miami. And so the Jennifer Valoppi podcast brings it all full circle for me. I want to make the life-changing content like we teach at Women of Tomorrow available to women of all ages, everywhere, anytime. This show exists to share honest conversations and meaningful stories about turning obstacles into opportunities and helping you become the person you've always dreamed of. It's all about women helping women. And our guest today is Dr. Sherrie Lewis-Thomas. Dr. Lewis-Thomas is a psychologist. She's practicing preventative mental health care, and she works with children, adolescents, and adults as well. She specializes in helping people with anxiety, depression, trauma, high conflict situations, and surviving abuse. She partners with patients to build resilience and create long-term wellness plans to empower her patients to take an active role in their mental health. And it's all based on proven therapies, which is really important, and understanding each individual's unique needs. Her practice is Miami Beach Counseling Associates, and you've been doing this for almost 30 years now. So I want to welcome you to the program.
Thank you. Thank you for having me.
Thank you for being here. And I guess I really want to start talking about what seems to be an epidemic in mental health these days. And I'm having a tough time figuring out, is that for real or does it just seem that way?
I think it's a combination. I think it is for real. There's some research that shows post-pandemic, for example, depression, some studies showed it doubled, some studies showed it tripled. Same thing with anxiety, wow. Same thing with eating disorders, substance abuse. So that certainly contributed. I think we're living in a world that there's extreme polarization in many arenas. And so I think that's a lot of stress for people. They're not sure, especially for those developing still and finding their identity. They're not sure which place to go, and it's not a very tolerant society right now of the middle, of finding that path. I think we live in an age where there's significantly more digital connection than social connection, which in some ways is wonderful, but also socialization is so helpful for mental health. Face-to-face contact where you're regulating. And so I think that's impacted it. So I think there's a lot of factors going on. We have socioeconomic issues going on. We have a lot of political instability. There's a lot going on. The environment's not really being brought up in a world that feels safe and stable. That's depressing and anxiety provoking for a lot of people. On the flip side of that, though, I think maybe a positive that it seems so more intense and such bigger numbers is I think there's also less of a stigma. I think people are talking about it more. People are more comfortable saying they're struggling and they're having issues. And so I think that is why it seems more dominant at some level as well.
So when you talk about like socialization, when we were growing up, people of our age, right, we kind of went outside and met our friends and actually physically had contact with them at all times. How do you feel social media has impacted this concept of anxiety and depression?
I think in many ways, isolation is horrible for both. And social media is a way to isolate. You're looking at the world around you, but you're not necessarily interacting with it.
You're not participating.
It doesn't require the same regulation that socialization does either. However you're responding, nobody's really seeing it unless you're doing something live on social media or recording yourself, which you can change it. There's also constant comparison, trying to create a persona that people will accept instead of just feeling confident being yourself when you create your own social media. And then there's also, I think, the element where anxiety and depression is concerned is we're in a state that there's immediate global awareness, not even local. There's a global awareness. So the trauma that people are experiencing, we can all experience it now, right? What happened here in our country, what's happened over in Israel, doesn't matter. We're able to see real time or within minutes the trauma, and trauma is experienced not only by having it happen to us, but by witnessing it as well. So I think there's many factors that contribute to it.
So you think shared trauma from something that's happening in other parts of the world is part of what's leading to anxiety.
Absolutely. Absolutely. I mean, I see people regularly in my practice who are traumatized by the things they've seen online.
I also think that young people today don't even feel comfortable sometimes making a phone call.
Right.
You know, they're just so used to texting or sending emails. Well, I guess really it's more texting,
Right.
that they're like scared to make a phone call.
Right. Right. And I think that's very true. And even I think it's even worse than that in the sense of if you've done a carpool where you see the kids sitting in the car, or you can go to a restaurant or walking down the street, people who are even supposed to be socializing and engaging will both be on their cell phones.
Mm-hmm.
Or you go to a high school prom even, and they'll be all on their phones. And that's tough. Or the stress of, do I hit like, or how many people are liking me? How many people are following me? Or even on Snapchat, they have these constant where they have these runs where they have to keep it up that they talk to each other nonstop at certain times, and you try to go for as long as you can. So there's even pressure in it.
Pressure just to talk.
Right. To keep the run alive, to have enough likes, to like enough, to have enough followers, and a lot of people want to be influencers now too. So that's pressure in itself.
So let's talk about anxiety. What is anxiety physiologically?
It's a good question. It's different for different people, but there's really common symptoms. Basically, what happens is we feel threatened. And if we aren't able to control that and say, okay, this isn't a real threat, then our sympathetic system, which is our nervous system, gets activated. And that can be trembling and shaking. It can be sweating or the reverse and chills, headaches, nausea, vomiting, stomach aches, diarrhea, feeling on edge. Some people think they're having a heart attack, numbness or tingling sensations. So there's all different types of dizziness. There's all different types of physical symptoms.
Hyperventilating, right?
Shortness of breath, your heart racing. Some people describe their chest feels heavy, like there's a weight on their chest. All of that is part of it.
You mentioned thinking you have a heart attack. How do you know the difference between a panic attack and a heart attack?
Many people don't, and they end up in the emergency room where they're then told they're having a panic attack. And it is difficult to tell. I mean, there are medical things that can create symptoms like that. For example, people have hyperthyroid, and that presents very much like a panic attack. Or people have mitral valve prolapse, and then they have some coffee, and then they're going to have a medically induced or substance induced, I guess, from the caffeine. So there are physical reasons to have panic attacks, and sometimes you can't always tell. And it is good to get checked out medically. One of the things about panic attacks is that they frequently come on very quickly, within minutes. A panic attack requires many of those symptoms versus anxiety, as you may just have trembling and maybe a headache, but you don't have multiple symptoms. And those can last for a very long time. So not always, and I don't want to step out of my lane because I'm not an MD, I'm a PhD, but typically a heart attack will have more symptoms or get worse as time goes on, right? But a panic attack, you'll have multiple symptoms very, very quickly. Within seconds to minutes, you have them, and then they take longer to dissipate, right?
How do you let them go?
How do you let the panic attack go?
Yeah.
You mean, how do you calm it down?
Yeah. If you're having a panic attack, and someone called me about this recently. She was having a panic attack, a young woman, and it was lasting for days. And I thought they came on suddenly, but dissipated quickly. And so I was surprised to hear that. And it's like there must be something you can do to stop that, right?
Well, typically an actual panic attack won't last for days. It doesn't necessarily go away quickly, comes on quickly, but it typically doesn't last for days. Now, a person may have them come and go repeatedly over days. So, and when you're in the throes of a panic attack, it's very hard to immediately get rid of it. It's something that you do better trying to start to identify when you're starting to feel anxious or you see the initial signs. And there's all different techniques. You can breathe through it, deep breathing, there's meditation, visual imaging. There's some people exercise, but once you've had that panic attack, once you're in the throes of it, that's not really going to help. So a lot of times it's self-talk of this will pass and not working yourself up more of, am I having a heart attack? Am I going to pass out? Just being able to tell yourself, identify it, this is what it is. try and take some breaths. But if you're hyperventilating, that's very difficult. So self-talk becomes really important and working your way through it.
So if someone calls you and they're in the middle of a panic attack, what do you tell them?
You'll get through this. We can stay on the phone together and get through it together. But I think it's one of the issues with a lot of mental health is we tell ourselves we have to shut it down. It doesn't really help. The idea is that, okay, this is going to be uncomfortable, but we can get through it, right? The idea is we're going to be okay. We just have to go through it.
So if you see someone who's experiencing that, what's the worst thing you can say to them?
Ignore it. This isn't really happening. It's all in your head. Because they're having a physiological response, right? It's okay to say, we'll get through this. You'll get through this and I'm here.
It's a fight or flight response.
It's a fight or flight.
Right?
Exactly.
So what, you have adrenaline and cortisol that's racing through your body.
Exactly.
Right?
Exactly.
And so your body is prepared to run.
Or fight.
Or fight.
Right.
But you're not. You're sitting there somewhere and instead you're just experiencing the symptoms of being prepared to fight.
Right. Or flight. Right. I mean, some people respond differently to anxiety. Some people will rage when they're anxious, right? Some people will retreat. People do respond differently. A panic attack is typically, I mean, there's different severities, but it's pretty incapacitating and it's getting through it. But again, it typically doesn't last for days.
Okay.
My guess would be that person had them coming and going repeatedly over days or felt an overwhelming sense of anxiety, which is different than a panic attack.
Okay, so let's talk about an overwhelming sense of anxiety. Let's talk about somebody who's just experiencing maybe one symptom. How can you help them? How can they put a stop to it?
Again, it's deep breathing. In that case, they can exercise, distraction, socialization is very helpful. Natural ways, though, are you're going to change your endorphins, your dopamine levels. Things change when you exercise, when you get in the sunshine, you change your brain chemistry. Limited times, of course, especially in South Florida, but there are natural things that you can do in socialization. I think one of the important parts is whatever your coping strategies is, again, exercise, some people journal, there's mindful coloring people do now. I think I already said exercising, deep breathing, visual imaging. Everyone has different approaches that work for them. The key is don't only do it when you're in the height of anxiety. The key is make it a part of your daily life. It's much harder to do it when you're in the throes of it. It's much harder. If you can develop it and make it a habit, it becomes much easier. I'll teach people to do progressive muscle relaxation with visual imaging, which is really you're relaxing parts of your body one by one, going through it, and then imagining a peaceful place for you. Once you do that regularly, when you start to feel a symptom, you can go to the places that you know your body holds your anxiety and go right for calming that down. You can go to the visual imaging that you've learned really calms you down. So I think it's like everything else. If you practice it and get really good at it, then in the moments that you really need it, it's going to help.
How about trading the sense of fear for a sense of excitement?
You can do that too if you're able to do that in the moment. Reframing is critical for everything. It's
because
really
a lot
helpful.
of times really the symptoms are the same as being super excited and happy about
That's
something, right?
That's right. And it works for a lot of people. And there's things now that they're also proposing in addition to the deep breathing is there's been some research that shows splash a little cold water on your wrists or behind your neck or on your face. So there's things too that they're saying will get your parasympathetic system to kick in and slow down.
So someone was telling me a bottle of cold water on your neck
Right.
is something that can be helpful. Okay. And when does a panic attack become a medical emergency?
It's a good question. I mean, I don't think that we know I don't know how a layperson really knows, am I having a heart attack or not, unless it's something recurring and they start to be able to differentiate and they've had their heart checked and everything is okay, because some of the symptoms can be very similar. But I guess if you're monitoring and you see that your blood pressure is extremely high or your heart rate is very high and it's not recovering, it's probably a good time to go to the emergency room.
I guess what I'm kind of getting at is an anxiety attack or even a panic attack, if that's in fact what it is not going to kill you.
Right. It won't kill you. Worst case scenario, hyperventilating. People do pass out, not so commonly, but the beauty of passing out is then your parasympathetic system comes in and re-regulates you. So sit down, lay down, and just let yourself get through it.
What's the role of hormones in anxiety?
There's lots of hormones that are involved.
Well, I'm thinking specifically, women's hormones, the estrogen and progesterone that comes in like premenstrually or something like that. What's the role of that? Or in a postmenopausal woman, what's the role of that with anxiety and even depression?
There's certainly more anxiety and depression for some people prior to their menstrual period. And then once they have their period, a couple of days in, they feel significantly better. And certainly for women hitting menopause, depression becomes more common, as does anxiety. Even aging for men as well. Aging is a place where the chemistry, again, in our brain changes, and we need extra help to get it right.
Let's talk about stage fright. It seems that almost everybody is afraid of public speaking.
I think it's testing my memory, but I think it's over 80% of the population is afraid of public speaking.
So how do you coach someone through that who wants to learn to be a better public speaker?
It's truthfully the same as all anxieties. It's finding that coping strategy that works for you. It's sometimes some people pick a person in the audience that they're very comfortable with and focus on that person. Some people look beyond. Again, doing self-talk, deep breathing during it. Sometimes even a little trick of pinching between your finger and your thumb here is not painful, but it gives your nervous system a different sensation. Some people tap their feet, reminding yourself this is okay, being able to look at your notes in the beginning or start with statements that you feel more comfortable with. Having a glass of water there. So if you get a dry mouth, you can have a sip of water. Giving yourself permission to be anxious. And as you said, reframing it as this is exciting. And once I get a couple of sentences out, I'll be able to calm down. There are medications people can take as well. And I'm a big fan of it's exposure therapy, systematic progression, where if someone knows they're going to do public speaking, is that they can start by practicing alone in the mirror and then doing it in front of friends or family, and then maybe seeing if they can get an audience of a couple of strangers, or going to the place, if they have that luxury, that they're going to speak. So doing things where you recondition that it becomes a calming space instead of an anxiety-provoking space.
Sort of a rehearsal.
Exactly. I think the more prepared we feel, we're typically calmer.
But what is that anxiety, especially for public speaking? What is that really about? Is that a fear of being judged?
I think it's different for different people. I think some people are afraid of being judged. I think some people are afraid of messing up and doing something that can have big consequences if it's a big work speech, or and a lot of people are afraid of feeling foolish. Some people are afraid that they're so nervous they're going to vomit or pass out on stage, right? So I think there's different reasons.
Do people pass out on stage? Is that something that's happened?
I don't know anybody, but I'm sure it has happened.
Do you work with clients to get to the bottom of what's causing that anxiety in the first place?
Yes, I always do. I mean, I also work with children, so children don't have insight. Their brain's not fully developed yet.
Right.
It used to be 25. Now they're suggesting it might be 32.
Oh, wow.
So, right. It's just recently shifted with some research. So, so sometimes you just need to work on the symptoms, and you may not ever really know the why. But I'm a big fan of knowing the why, because I think a lot of times things are more the symptoms. And if you can get to the root of the problem, then the symptoms disappear. If you treat only the symptoms, then I think sometimes a different symptom replaces it. And there are times, we were talking about anxiety and depression and a fear of speaking. But obviously there's times that doing it alone isn't the way to go, that you want to get help. And I think that anytime it starts interfering with your functioning, it's time to get help. And the way that mental health works is the earlier you hit it, the earlier you address it, the easier it is to overcome it, the easier it is to work through it and be able to manage it. The more severe you let it get, the worse the prognosis is.
So what about something like systematic desensitization? Is that something you use for anxiety?
I do. That's what I was saying about with, for example, the public speaking is starting saying it in front of yourself in the mirror, and then you graduate to more places.
Right.
For people who are afraid of flying with phobias, it might be driving out to the airport, going into the airport but not getting on the plane. if you can afford it, getting a ticket and getting on the plane and then getting off the plane. There's also now, with the beautiful part of the computer, is you can do simulated, right? Watching flights a lot. And so you do step by step.
So let's talk about depression for a minute. I read a statistic that this has been the highest rate of suicide since like 1941 or something like that. What is that all about?
I think depression rates are higher. I think ways to harm yourself are pretty accessible. I think there's also, I can say from my patients, I'm hearing accessibility again on the internet. It's pretty easy to find out how to do things. And I think people are feeling overwhelmed and hopeless and not seeing other options, unfortunately.
How do you know when someone's clinically depressed versus just sad?
It's a great question. One is the amount of time that they stay mostly sad, or in adolescents or children, it can be an irritable depression. It doesn't even have to be sadness. It can be frustration and anger. A person seems very irritable. But it's a multitude of factors. You want to see changes, like changes in sleep. Either they're sleeping too much or too little. They're compared to what they used to. You're seeing changes in appetite, hungrier or less hungrier, weight gain or weight loss, changes in energy, changes in motivation. A lot of times with depression, it becomes harder for the person to focus. It becomes harder for them to remember things. They're feeling sad a lot. You'll hear a lot of guilt. They'll express a lot of guilt. They tend to isolate more. So you see a multitude of symptoms coming together, and it lasts for several days, weeks. It's not just a bad day.
Is depression about anger turned inwards? I've heard that.
For some people, it can be. For some people, it's just sadness. I mean, some people, for example, may have the loss of a loved one and get sad and struggle to overcome that, where it just gets worse and worse, and they isolate and it turns into depression. And we can have situations that make us down. And typically when you've had that for a long period of time, then the chemistry in your brain even changes.
But it is normal to be sad when
Yes.
you lose a loved one.
Absolutely. Absolutely.
How do you know it has now transformed into depression?
Because you're not having those joyous moments. You're not, we do get sad when we lose someone, but we also are able to have fun at times. Maybe not immediately after,
Right.
but we start getting our functioning back. Again, may not be the same level prior to, but we see light, right? We are hopeful about the future. So it becomes a problem when you're having many of the symptoms and they're taking up most of the days, almost all day, right? So, and it's interfering with your functioning. Then it's turned into something that's no longer adaptive.
Is depression about unresolved grief?
Sometimes it can be about all different things. Sometimes depression is just chemistry, right?
Is chemistry the more modern way of looking at depression?
I think chemistry has always been an issue. I think maybe now we have more science to back genetic predispositions, looking at genes, blood work, etc., brain imaging. But I think that there's always been both. I think that there's always been chemistry, either caused by environmental issues or started chemically that way. And I think that there's some that's not chemical. It's environmental and things that have been happening. But again, if you're not able to resolve it with talk therapy, sometimes just by doing therapy, you can get rid of the depression. Other times it requires chemicals to help with the brain chemistry.
When you say chemicals caused by the environment, what do you mean by that?
Well, one is like we were just talking about, if you stay if you stay depressed for quite a period of time, then it actually alters your brain chemistry, right? There's a lot of research that shows when a person experiences a traumatic event, it can actually alter brain chemistry. There's also research and debates about toxins in the environment and affecting, serotonin, dopamine levels. So there's, as you were talking about earlier, menopause, menstruation, there's things that can have testosterone levels change. There's things that can happen that affect as well the brain chemistry. Just aging in itself affects us.
If you focus on negative thoughts, don't you sort of more deeply ingrain the grooves in your brain that make it more likely to go to a negative thought or the synapses?
Well, at a minimum, you're certainly conditioning how you think. So I'm not sure how much matters if it's the chemistry or the thought pattern, but we do train ourselves on how we think. And that is one of the symptoms of depression is pessimistic thinking, negative outlook, right? And so it's a catch-22 is that we want to try and be able to see the positive. It's really hard to do when you're depressed. Or an anxious person is a what if and goes to the catastrophe. And it's really hard. It's a reconditioning. It's where therapy is helpful, is reconditioning to be able to see the positive. But you have to be careful of being positive at times that aren't appropriate. For example, someone's just died. We don't want to say, and people do this, good intentioned, oh, this will make you stronger. They're at a better place. Those are very hard things for people who've lost someone to hear when someone's died, because it's okay to be sad. As you said earlier, it's a normal part of living. And we have to allow people, and mostly ourselves, because I think we're hardest on ourselves, that it's okay to be in these uncomfortable spaces. It's okay to feel this. What we need to do is trust that we'll get through it. That's where we fall down. I think that's where people really struggle, is this concern that this is how it's always going to be. I can't feel it, or I need to be over it already. And it's okay. It's okay to suffer. It's okay to feel pain. We just need to get through it and be able to reframe it and be able to find joy again and peace.
What should you say to someone who's experiencing anxiety or depression to help them get through it?
You're not alone. I'm here. You can talk to me anytime you need. If I'm available, if you're having an anxious moment, call me. We'll breathe through it together. We'll get through it together. I'm confident that you can do this.
We see all these people with great lives, good lives. They're, doing very well. They have families, they have jobs, and yet they're depressed. And I think that's difficult for most people to understand.
I think we see that with everything. I mean, research has shown whether it's substance abuse, domestic violence, suicide, depression, anxiety, schizophrenia, they're not bound by socioeconomic status. It's not dependent upon what career you have. It's not dependent upon what education you have. It happens to all of us. I think everyone has problems. They're just different types of problems.
How do you see substance abuse impacting mental health?
It's terrible for it. I mean, it destroys it.
We used to have an old television commercial with the egg in the frying pan that drugs fry your brain. Is that true?
To a degree, yes. I mean, it depends upon the drug. It depends upon the amount, but it's certainly not good for us.
You see a big push these days to legalize pot. And it has been legalized in many places, but pot is also, marijuana is different today than it was 20 or 30 years ago. It's way, way, way stronger.
Correct.
So how does that impact mental health?
I mean, I think we're still learning, truthfully. I think there's a lot that will come out in the future. I do see where some people it helps. I think it depends upon the quantity. Now you can buy different levels of strength. So I think that matters. I think if it's being used, and there are doctors who are supposed to help you through it, I think if it's being used medically the way it's supposed to be, I think that I do see people that it helps. I think the issue is the risk of using it excessively or not in the way it's supposed to be used.
I mean, there are a lot of places now where it's available recreationally.
Right.
Do you see it having a negative impact on people?
On some people, absolutely. On some people. I mean, I think that there are addictive personalities. I think there's some people that struggle with moderation. And I think regardless of the substance, I think, and not even substances, whether it's gambling or people have sex addiction or people binge watch Netflix now, where the next thing they know, 2 days have disappeared. So I think that I think it's really important to not let whatever it is take over your life, even social media, right?
I know you're a PhD and not a medical doctor, but when do you recommend that someone get on medication?
As a psychologist, when they've tried talk therapy and they're doing everything they need to be doing, and it's still not getting them to where they need to be, or they can't find the motivation to do it because they're just so down or so anxious that their physiological response won't let them follow through on the homework, on the techniques and strategies that they need to do. Or if someone comes in so severe that waiting for the therapy to work is too big a risk.
On the other hand, sometimes it seems like half the world is on antidepressants. So do you think there's an overuse of antidepressants?
Yes, same way I think there's overuse in many medications. Pick your field. There's certainly, unfortunately, I think in all the different specialties, doctors who will overprescribe, and there's people who want the quick fix. But the truth of the matter is an antidepressant isn't a happy pill. It doesn't make you happy. What most of the drugs do is take away the intensity so you can do the work. And most good psychiatrists will make sure that you're also doing therapy while you're on medication, because the idea in many, not all, but many of the mental disorders is that you can do the medication to help you be able to do the work. And in combination, they work great. For example, ADHD, the research shows medication, therapy, behavior modification, and school intervention. So the school's doing compensatory mechanisms as well. That's what eliminates the symptoms of ADHD, those three working in combination. But research also shows if you have to pick one, medication is the strongest for that. So it depends upon what you're talking about. But I think most things, doing a culmination of approaches is typically what's really helpful.
What do you do if someone threatens suicide?
Well, there's a protocol. One is seeing how serious that threat is. We can never predict suicide, but if you have things, there's different indicators that have said, okay, this is more serious and we need to really do something to protect this person. In Florida, we have a Baker Act. So if you can't get them to go voluntarily, then you actually call the police or a family member who can take them to the hospital and they get Baker Acted.
And what should a parent or a spouse do if they feel that, or a child do if they feel that, one of their loved ones is threatening suicide?
For a child, I think talk to a parent, talk to any grown-up that will listen to get help. And it's true of anyone, actually, because it's a lot to handle. But I think it's take it very seriously. I often will hear parents say about, especially adolescents, when they threaten cutting or killing themselves, suicide, that they think it's manipulative and dramatic. But even the fact that that's the place you go to is a sign of a problem, right? It's a sign that this is more serious, that this person thinks this is how far they have to go. And if you know about it, then it's a cry for help. Then that person, the healthy side of them that's saying, I don't want a permanent solution to a temporary problem, that healthy side is asking for help. So it's really important to get that help, whether it's calling a psychiatrist or a psychologist, mental health professional, which truthfully in today's day and age, it's really hard to get in right away. Everybody is busy. So, and it's not, as I'm sure most people are experiencing, whether it's medical or psychological healthcare is expensive now. It's not so easy anymore. A lot of people are doing concierge and not on insurances. And so it's not always easy to get that right away. You can go to an emergency room with the person, right? Don't leave them alone. Try and talk to them. Let them know they're not alone. I'm hesitant to say this because I don't want people to take it on as their own. It's really important to get professional help. But trying to find reasons for the person to stay alive. Sometimes they don't want to stay alive for themselves, but you can talk about how important they are to you and how much it would hurt you if you can find reasons. Look for things that make them hopeful about the future. And there's a suicide hotline, which is 988. Not really sure how long that's still going to be around because there's been a lot of cuts to mental health. But as long as that's around, it's a confidential call. And you don't have to be the person feeling suicidal. You can be someone who's a support system to them and call for help.
Just 988?
988.
That's the suicide hotline.
988. And you can also call the police yourself for assessment.
If you're having an issue.
If you're having an issue or someone you love is having an issue. They do wellness checks. So let's say a friend called and said something to you that just felt like a goodbye, right? Just didn't sit right with you. Because that's more likely if a person really wants to kill themselves and is planning on going through with it, oftentimes they don't tell another person. Don't get me wrong. When a person says something, those people kill themselves too. Take it seriously. But there are people who aren't able to warn and aren't able to ask for help. So if you have that call or something just feels really off and you're reaching out to that person and they're not picking up or they're not responding and it just feels really off and you're not where they are, you can call the police and ask for a wellness check. They'll go knock on their door and they'll assess, and they're trained to assess.
What does that mean if someone is cutting?
It means that they found some sort of object to actually cut themselves.
Where does that come from, cutting?
That's a lot of different theories. Some people will describe that they feel numb and they want to feel. Sometimes it's a form of self-hatred. Sometimes it's a form of control. Sometimes it's a form of anger. It has all different reasons.
And what about like anorexia? Is it a similar concept for people who lose the sense of their body image, especially with all the GLPs and things like that these days?
Yep. So again, lots of different theories and lots of different reasons. But there's a lot of theories that anorexia is poor body image, right? But also, again, control comes into that, to have some sort of control. Resilience, in one of the important factors behind resilience, and research now shows resilience is key for successful careers, successful parenting, successful relationships. And one of the factors behind resilience is feeling power, to feel that you have the ability to make choice, that you have the ability to create change, that you still have control of your life in some capacity. And oftentimes when people feel they have no control, maladaptive behaviors can come into play, like cutting, withholding food, or purging, right? Sex, gambling, things people will do that are maladaptive behaviors to say, I'm in charge of this and no one can tell me what to do.
So what do you do to help people feel like they're in control of their lives?
Try to find adaptive ways where they're in charge, right? Try to find ways. We have many places we can make choices and be in charge every day. Here I work sometimes with high conflict cases in the family court systems, which seems to be on the rise, right? Especially post-COVID. And children, those are tough stories. Children will be taken out of homes because of parental conflict. Just one day suddenly not seeing a parent anymore. Talk about feeling helpless, right? Or poverty that's happening, or children of alcoholics or addicts. And it's about showing them where they have choice. A court can come in and say, or a parent, you have to do this, but how you do that is completely within your control, right? So a child who's taken out of a home and put in another home, the relationship that they choose to have with their parent, no one can control that but them. How they adapt to it, no one can control that for them but them. So it's helping them find ways where they are in charge, where they can navigate it in the way that they want and feel a sense of control.
So let's talk about marriages and the impact on children. Is it better to be in a bad marriage for a child to see their parents in a bad marriage, or is it better for them to be apart?
Great question. I keep answering you with not an exact answer, and forgive me, but psychology is not an exact science. It is theories. But the research that I've read talks about a volatile relationship is detrimental to children, and that you're better off to be divorced. However, the research has also said if you're going to be divorced and expose your children to a lot of conflict, then it's actually better to be together.
Interesting.
So the concept behind getting divorced is so that you're bringing peace to your children's life.
Okay. So what about if you're in a relationship? Should people who are just dating go to marriage counseling?
People do that. I mean, obviously I'm biased. I think therapy is growth oriented and it helps us be healthier and happier in every aspect.
So when do you say to couples, stay and fix it, or just leave?
I don't ever say that, except for probably domestic violence, right? If there's domestic violence that people don't want to change, that the attacker is not wanting to change or not doing the work to change, it's not safe. And then you need to get out. You need to be safe, and figuring out how to do that in a safe way. But otherwise, I'm pretty careful about not doing that, because my life doesn't change, right? The people who are going through that are the ones that have to live with that decision.
Do people who are physically violent actually change?
Yes, I think some people can. I obviously believe in change. It's what I do for a living. But what I'm pretty clear on is that we can't change other people. They have to want to change. As a psychologist, I can give them the tools to change, but ultimately the change is within a person. They have to want it.
What are the warning signs you're in a bad relationship?
That's a great question. That could be tons. Obviously, domestic violence. I think a relationship is mutual respect, right? And admiration and cooperation. I think a long-term relationship, it's not 50-50 all the time. I think it fluctuates, right? But if you're in a relationship where it's making you sad more than happy, or even equal, truthfully, if you're sad just as much as you're happy, or where you feel negated or irrelevant, it's not a relationship to be in. I certainly say work on it if you guys have really invested and have children or things you've worked together, then work on it. But relationships are supposed to bring you joy most of the time.
I'm looking for a definition between somebody who might be physically abusive and someone who might be just verbally abusive, and how damaging both of those are.
So they're both considered domestic violence, actually. And you can even have financial control that can be considered domestic violence, and they're all destructive.
Talk about financial control and how that is violence.
Some people in relationships will not give the other person access to money, right? So that limits them, and they need permission to get the money, or they're told only how they can spend it. There is a difference between collaboration, where a couple may talk about before they're spending their money and how they're going to spend it, especially when it's larger sums.
Right.
And that's okay. That's collaboration. But there are actually relationships where you have to perform certain acts to get money, or I'm going to tell you how much money you can get or how you spend your money. And it can be used as methods of control or punishment. That's not a partnership. That becomes domestic violence. It can be used to, there's no way you can leave me. I'm not going to give you enough money to do that. Or I'm not going to give you the money so you can go out with your friends tonight. Or so when it's used as a method of control, it becomes domestic violence.
So let's talk about warning signs. What are the warning signs that if you're not in an abusive relationship, maybe that's where it's heading?
So, for example, physical abuse. You may see a person punching walls or throwing things, right? You may see it start being the glass that used to get thrown on the floor, which is already a warning sign. It doesn't mean a person's going to hit you, but it is saying this person loses control when they get angry, and they get physically aggressive when they get angry, right? But you may see progression of they throw it towards the person. But remember, there's also physical aggression that never had a precursor. I mean, people sometimes just lose control for the first time, right? It's not always a progression. And I think that is one of the myths, is that there's warning signs. Not always, right? So I think one of the biggest warning signs is there's been a prior act of violence, right? Substance abuse makes it more likely. So and it's the same for verbal abuse. If a person maybe starts with calling you stupid, and then it graduates to cursing at you and demeaning you, right? So I think boundaries and limits are really important. Another sign of resilience, right? And it's okay to tell the person, I'm not okay with how you're talking to me. And I think sometimes we're human. Sometimes people get angry and they'll yell and scream. And hopefully one of us can be level-headed, because it's the worst time to have a conversation. You cannot be rational with someone who's irrational. If they're yelling and screaming, it's saying their sympathetic system is in action. They're irrational. They're thinking with their primitive brain, their amygdala. Let's calm it down and wait till we can have a productive conversation. So it's okay to say, listen, I really want to hear what you're saying. I can't hear you like this. Let's calm down. Let's take a breather. Let's come back and talk. That's a healthy limit.
And what if they follow you through from room to room saying, just continuing to yell and continuing to complain? What do you do?
So that's a place when they're calmer, you want to set limits and talk about that and say, we're not going to do this going forward. Those are signs of unhealthy, maladaptive communication, right? But also it's okay to go in the bathroom and lock the door. You're allowed to do that. You're allowed to set a limit that says, I'm setting it, you can't honor it, I'm going to make that limit happen.
What about people who try and isolate you?
It's not healthy to be isolated.
Is that like a precursor to abuse?
It can be, absolutely. I mean, one of the things that keeps people from leaving is financial insecurity, fear of being able to
Right.
afford to live on their own, fear of being harmed if they leave, and being all alone. There's a lot of shame in it. Like, how did I get here? Why did
Mm-hmm.
this happen? Which there is no shame in being a victim. You didn't ask for this to happen, right? The person who harms is the person who's responsible. Period. End of report.
So why do people stay in abusive relationships, and why do, even when they get out, go back?
So, as I was saying, one of the things is financial insecurity. People are afraid. A lot of times, those are places that money's been controlled.
Mm-hmm.
Um, there can be, they've isolated themselves or been isolated. They've now abandoned all friendships, family members. They are afraid of being harmed even more, so they're afraid of leaving. And there is a process that happens that's more common in domestic violence where the episode happens, and then there's what's called like a honeymoon phase where the person who harmed is so apologetic and crying and professing their love and they'll never do this again. And the person loves them and builds empathy and wants to help them get better. I do think I'm going to be a little sexist for a moment, but I do think as women, we're taught from a very young age that if the person loves us enough, they'll change who they are. That's a sign of love, is how we're brought up. If you just look at the story of Cinderella, he was willing to give it up all for the love of his life. And we can look at one story after another that is that way. So I find myself repeating frequently in work, it's important to love what you have, not what you think you can turn them into, right?
Mm-hmm.
And we get stuck in that. There's also the element of part of abuse is ruining your self-esteem, right? You lose confidence, you don't think much of yourself. And so I've heard people say, if I had just put dinner on the table, this wouldn't have happened. Or he was right, I was a little irritable and snapped at him. I should have been kinder. So there starts to be this mentality that I deserved it and I can do better and then I won't be hurt.
Mm-hmm.
It's a process.
Mm-hmm. When someone is abusive to someone else and they say during the honeymoon phase, oh my God, I'm crying, I'm sorry, I'll never do this again. Does that really happen?
That they never do it again?
Yeah.
I'm sure there are isolated incidents, I'm sure, but sometimes you have the perfect storm. Probably more common than not, it happens again.
Mm-hmm. What about when children have been in an abusive situation and then they always want to go back to their abusers?
So this is an interesting phenomenon that I haven't really truly figured out yet. And I see it everywhere. It's not just with abusers. And adopted kids who will desperately want to meet their biological parents, right? Or I've had kids who were the product of sperm donors and they want to meet the sperm donor, right? That there is this very strong pull even when they've never met the person. I mean, I've also seen children who reject a biological, so it works both ways, but it's not uncommon at all for children who are abused to still want to be with the parent, the abuser. For many of them, it is what's normal. They don't know different.
Mm-hmm.
They haven't been shown a loving environment. They don't know what it really looks like. I mean, your world, and especially as a child, is what you know. And oftentimes in homes that are repeatedly abusive, there is an isolation, as you were saying before. So they're not going to other people's homes and seeing what life can really look like, right?
And also just the insecurity, the being, needing to be clothed and fed and all the rest of it.
That's right, survival. And not most parents who are abusing their children are not saying, I'm so sorry. You don't really have the honeymoon phase there. There's not, I'm so sorry. It's, you should have done this. If you do this, this is why it's
Right.
happening. It's the child's fault.
You're in an abusive situation. How do you get out?
It depends upon the severity of it, but one is establish some relationships, have a safe space, a person you can talk to, that you're not feeling shame, that you know this person has your back. There's no place for shame. You've done nothing wrong. Unfortunately, people feel that shame, but find your safe person, your safe space. Maybe pack a bag of clothes, important things, make duplicates of your important papers, and keep them somewhere. Have a spare set of keys that you keep somewhere so that you can leave and feel safe leaving. Because for some people, it's escape. It's not just the ability to walk out the door.
Mm-hmm. And once you do get out, once you have survived an abusive relationship and gotten out to the other side, how do you survive the trauma of having been through that relationship?
It's a good place for therapy. It's a lot of work, and it's learning to reclaim your life. I frequently tell patients there's a difference between being a victim and a survivor. And you're healed doesn't mean you won't continue healing, and it doesn't mean that you're not scarred, but you become a survivor, you've reclaimed your life. When you're abused, when you experience some sort of trauma that's abuse, you're victimized. It's terrible, and you lose so much. And I think it's really important to try to find ways to not let them take anything else than they already have.
What is love bombing?
There's two types of things in this world when you're dating and you're meeting people and you're exploring. And one is that we all tend to put our best foot forward when we start, right? And it's why I think sometimes it's great not to rush into things and let time prevail and let what's really there shine through, right? And also during the infatuation stage, we tend to see things not so clearly ourselves, right?
Yeah.
So that exists just by the natural act of dating, I think. But there's another element that there are people, unfortunately, out there that are manipulative, that are more predators, and I think they're good at what they do. They can be very, very charming, and then again, over time, things shift. There's also people who aren't necessarily predators. There's people who have sort of a toxic love, if you will, that they can be sincere in the beginning, but once they start feeling vulnerable, that's a very uncomfortable feeling for them. And the way that they respond to that is maladaptive. So they become controlling. They shift very quickly. And this amazing, loving, supportive, build you up, complimentary person has now become very controlling and distrustful and possessive. And so there's all different reasons why it can shift. I think the important part, again, is not trying to figure it out and fix them, but set your limits and boundaries and be honest with yourself about what you're willing to tolerate and not tolerate.
How do you know if someone's gaslighting you?
I'm a big fan of trust your instinct, right? I think it's important to be open to feedback. And if you're self-aware and you're open to feedback and you look at it and it doesn't fit, trust yourself.
Well, define gaslighting for everyone.
So gaslighting is when another person makes you think the problem is yours. Like maybe you bring to somebody, you were yelling at me and I don't like it when you yell at me. And the person may say, I wasn't yelling at you. That wasn't yelling. You're so sensitive, right? So suddenly it's not their problem, it's your problem.
Right.
That's a nice example of gaslighting. So to me, I think it's important because we can be wrong to look at that, to say, okay, let me think about this. And maybe even next time, if you want to give it an opportunity for next time, pay a little bit more attention. Okay, he presented a different perspective. Let me be open to that. No, you know what? This was really volumes above. I'm going to go. Or maybe in the moment, I'm going to say this time, this is what I'm calling yelling, right? And if the person again is like, see, this isn't yelling. You're crazy. This is just talking. You are so sensitive. Everybody says I don't yell. After you said that to me, then trust your instinct. And truthfully, at the end of the day, it doesn't matter. If you feel that that's excessive, that's all that matters. Then lower it a couple of notches, right?
Mm-hmm.
So I think it's about being open to feedback, but also trusting your instinct.
What role do pets play in mental health?
They can be wonderful. Again, there's the flip side of saying where pets have harmed people and they're traumatized, but most pets are calming. Now they bring them into retirement villages or nursing homes. They're bringing them into hospitals. People have emotional support animals, although we know lots of people say they are when they're not, but it has a real calming effect. It helps people feel more peaceful and calm. They're wonderful.
I always think pets are healing.
I agree.
Yeah.
I think so too.
What do you think about people who use ChatGPT or some AI for therapy these days?
So I've seen where it's been wonderful in the sense of an adjunct to therapy. So for example, I'll do a self-esteem list with patients where to build their self-esteem, we'll talk about positive attributes they have, positive traits that they have. And I have patients who've used it with AI to say, every day I'm going to journal my day and tell me about how those attributes have shined through for sort of an intentional, mindful way of living, right? That I want my responses and thoughts to be consistent with my goals in life and who I want to be, which is a beautiful way to live, right? And so AI has said to them, okay, this fit with this and this fit with this. It used to be in the old days, I'm showing my age, but it used to be patients struggling with social skills, that small talk when they went out with people and were really uncomfortable with it. We would practice in session, but therapy is 45, 50 minutes, typically once a week at most, unless you're in a crisis. So they were getting a book and reading about it and then going out and practicing. Well, now you can practice with AI. You can say, okay, I need to work on my introductory skills. So can we practice? I have people that practice interviewing with it. So I think that there's places that it can be okay. I think there's places, like I often see AI is wrong, believe it or not. Like there are things that I'll put to it to see and I'll be like, not exactly, but this. And then I get, oh, well, thank you for pointing that out. You're right, right? So if you don't know it, it can be very difficult. And so I think it's important not to use it as your therapy. I think to look at it like a form of journaling, that maybe it can offer some clarity that then you can talk to your therapist about. Oftentimes people will come in saying, I want to do this therapy approach because chat said this is what I need to do.
Right.
Okay, but can we really see? And I'm a big fan. There are definitely people who will do only one theoretical approach, and that's okay. There's people who do DBT or CBT or EMDR, or there's all different approaches. I tend to be a more eclectic approach that will pick and choose from all different theories because I'm a very more flexible thinker. I'm not so black and white in that I think lots of theories have great things to offer and they have some things that I don't think work as well. And research for most things shows the approach is not necessarily as important. So that a lot of them have things to offer.
I remember research many years ago that showed that the type of therapy you choose is not as important as the degree to which you believe the therapist cares about you.
Right. There's a lot of research that says the relationship is critical.
Uh-huh. So there's also a dark side to AI.
Mm-hmm.
And we've been hearing how it's encouraged people. Well, there's a couple lawsuits about one where it's encouraged people to commit suicide, another where it encouraged someone to commit murder. How do you tell people to navigate that if they're not thinking clearly in the first place?
Yep. So they're typically not going to share with me that they've researched. Unfortunately, the people who are really great at getting around the stopgaps are our adolescents, right? And our kids and the people who are most influential. Again, there's so much research that says what's really important with the internet, with social media, with your children, adolescents jumping on the computer, their phones, their iPads, you name it, is parental involvement. It's really important to talk about the things they're seeing, even sit down and do things with them. Mm-hmm. You know, sit and play a video game, even though you're going to stink and they're going to tell you how bad you are and how much they hate playing with you. So you can see what they're experiencing to talk about it.
Yeah.
And look, every generation has had, this is the death of us. You know, rock and roll was terrible. Phones were terrible. Then the cell phones, then the computers, then the internet, then the social media. But the truth of the matter, it's about sitting down. It's about parents still parenting and sitting down and talking with your children. I watched Roadrunner, again, aging myself, growing up. But you know, the coyote would jump off the cliff with a bomb and get right back up and go. But right. I had parents who taught me that's not real life. You do a bomb and you're dying and you're not coming back. And right. So it's no different with the gaming that's really violent, and is to say this isn't what it's like. It's incredibly traumatic, and you know, these are the actual consequences. The graphics now are more real, but now kids are even seeing, you know, mass shootings. They're wearing GoPros and they're on the internet for a while before they take it down. So the kids are really seeing what it's like, which is callousing it a bit, right? Mm-hmm. And creating that anxiety and trauma that they didn't actually experience.
How do you get over trauma?
You go through it. I mean, you have to experience the pain that it's caused, and trauma is something that really is a place to get professional help. I mean, there's different levels of trauma, but it's a place to get professional help. And it's about being able to reframe it. It's about being able to reclaim your life. It's about feeling powerful again. It's about making a determination that I'm limiting how much it gets to take from me. It's about great support systems. It's about trying to push yourself to continue functioning.
Mm-hmm.
It's really about reclaiming your life.
We do all go through traumatic situations in our lives.
Yes, we do.
Some people are more resilient than others. Can you teach resilience?
That's all you do. Resilience is not a genetic trait. It's a learned behavior and thought process. And it's all from experience, exposure, and learning.
How do you teach resilience?
It's a good question. I mean, again, it's helping from a young age the importance of social systems, modeling support systems, making sure they're having friends, planning play dates, looking for family systems, aunts, uncles, grandparents, in addition to parents. Because I think part of the normal developed process is you go through a phase where you really don't want your parents to know how you're trying to find your separation and identity.
Mm-hmm.
And so make sure that there's adults in their life that you're okay with, that they talk to, and those adults may not come share with you, but you trust they're going to guide them well. Make sure they have friends, and values are really important. Whatever your value system may be. For some people, it's religion. For some people, it's spirituality. For some people, it's ethics. Whatever it is, mindful and intentional, like I was talking about before, of we're living our life in a way that is true to that. So how we respond to whether it be joy or trauma is about who we want to be. We're not chameleons. We look for everything to be a response that's true to who we are. Those are the things that the environment and people can't change, right? If we want to respond as who we are and be true to ourselves. So teaching that to our children, teaching them to identify feelings is super important. And the more you can identify how you're feeling and talk about it, that's a protective factor that helps us. And so I think as they're growing, letting children, and even as adults, pushing ourselves to have some situations that are uncomfortable. It's a lot harder now with kids and adolescents and even adults because, truthfully, distraction is so easy and we're used to constant stimulation. So we can occupy our mind and escape pain very quickly, right?
Mm-hmm.
We don't have to look inward and we don't have to feel the sadness because we can just jump on something and distract ourselves. And that's going a mile a minute, so it's keeping our brain occupied. But it's okay to sit in that uncomfortability and show confidence. You can get through this. We will get through this together. You're not alone. Support systems are critical.
You hear people say, I want to live my truth. But I mean, what is that? There's my truth, your truth, and the real truth, right?
Right.
What does that mean when somebody says that, and how do you get them to sometimes get back to reality?
Yeah, so I think there's a lot of sayings now that have a lot of different meanings for different people. Even trauma, like I get triggered by hearing the trigger statement, or phrase, I guess. But even trauma, like people say they have PTSD, but by definition, that is like a life-threatening or injury. I mean, it's a very significant event. Whereas most people have had some sort of trauma by the time they're 17, right? That's not the same as a near death or significant injury. And so I think my truth is the same thing. I think it has different meanings for different people. Some people will use I'm living my truth as a method of not having to filter how they speak, right? Some people will use it as a method of not having to abide by societal norms. Some people will use it as I want to be sincere. I want to be genuine. I want to accept myself as I am. So I think it, again, depends upon how a person's using it.
If you're in a high conflict situation, how can you manage that?
I think trying to de-escalate is always important, and holding on to the concept that you cannot have a rational conversation when someone is irrational, and holding on to the concept that it takes two people to fight,
Mm-hmm.
right? It always takes two people. You can disengage.
What about people who excessively avoid conflict?
I don't think that's healthy either, right? I mean, conflict is a part of life, and I think that it's hard to assert yourself if you're afraid of conflict, and then I think you have a lot of needs that go unmet. And I think often people who avoid conflict tend to be people pleasers. They tend to be amiable, and I think after you've lived a little while, you find out you can't please everyone. You're going to have people that are dissatisfied. And if that's where you're finding your joy, then it's going to be a fleeting joy. It's going to be very fluid. I also think everyone's needs matter. So it's important. And sometimes asserting ourselves and setting limits and boundaries does create conflict.
Mm-hmm. What's the most important advice you give to people who are afraid that they're struggling with some mental health issues?
Get help, right? The earlier you address it, the easier it is. And you're not alone.
Do you think that in today's day and age, people are more susceptible to mental health issues? Or is it just because we talk so much about it?
We have to be mindful of, with COVID and shutdowns, there were a lot of developmental phases that were lost that people go through in growing. And we are so far from understanding what was lost. I actually don't think there's been a ton of research on it yet. And so conflict resolution, frustration tolerance, socialization, all those things, they didn't happen. Creative thinking, the ability to compromise, to share, wasn't really happening, right? So figuring out how to fill up your day when you're out in the world or going from transitioning, all those things were lost. Brain development from an educational perspective, so many things were lost. And it's kind of hard in your teenage years to individuate, which is a really important developmental phase, if you're with your parents all day long and in the same house, right? So experimenting and falling down and building resilience. Where was that, right? The resilience, I guess, was not being able to be with your friends, or but you didn't have the fight with a friend at school or feeling picked on a little bit, or we didn't have the frustration tolerance and the resilience and the rebounding that was required. And so I think that I think there's a lot of things going on that's making mental health more difficult, but I also think at the end of the day, people are talking about it more, which is really healthy and I'm happy about.
And final question, if there's one trait that you could teach people to have better mental health, what would it be?
Resilience. 100%.
Perfect. Sherrie, thank you so much for being here. Let us know one thing from today's episode that resonated with you and send it to us on my social media at Jennifer Valoppi, or you can put it in the comments and we'll post it and read your responses to hopefully help other women who might have missed it. Now, every episode we do ends with a micro action, something very simple that you can do now to improve your life and move yourself forward. Today's micro action is to think of a moment when you felt stuck but you managed to push through. What got you through it? And where in your life do you need to activate that same resilience today? Remember, every step you take takes you one step closer to your future. And finally, we support the Women of Tomorrow Mentor and Scholarship Program and the thousands of young women who are served through mentorship, education, and access to opportunity. If this conversation inspired you at all, please subscribe. Follow me on social media at Jennifer Valoppi and learn more about the Women of Tomorrow Mentor and Scholarship Program at womenoftomorrow.org. Your donation can help us change the world one young woman at a time. Thanks for listening.